Come in.
Hi.
Hello.
I'm Morgan Osville. I'm the physician's assistant student that's going to be taking care of you today. How are you doing today?
Good.
Great. Okay. And before we get started today, can you just verify your name and date of birth?
Name, Leighton Swoboda. Date of birth, 09/01/1952.
Okay. Perfect. Okay. And is Leighton how you would like to be addressed today?
Yes.
Okay. Perfect. And so today we're just going to be doing a little bit of testing and some chatting about your concerns why you came in today. Is that okay with you today?
Yes.
Okay. Perfect. So I have today you're here for just some recent episodes of forgetfulness or just feeling like you're not keeping track of things as much as usual. Is that right?
Sometimes I walk around the house and I'll catch myself like forgetting what I'm doing, or I'll read a page of a book and I won't register it at all.
Okay. Okay. Do these stop you from being able to do any normal things like driving or taking care of yourself?
Nope.
Okay. Very, very good. Okay. So what we can do today is a quick test just to check for cognitive function, which looks at your language, your ability to perform different tasks, follow some instructions. So we're going to do just a quick little exam that I'll walk you through. Is that okay?
Sounds good.
All right. Perfect. Okay. So as a part of our exam today, I'm just going to put a couple things out on this table. Don't worry about them quite yet. All right. So first off, Leighton, what is the year, season, date, day, and month?
It is summertime. It is May 20th, 2024, and and it's Monday.
Perfect. Okay. And then if you could tell me where we are, so like state, country, town, hospital, and floor.
Texas, USA. We're in Memorial Hermann. We're on the 3rd floor. Was there another thing?
The town.
Oh, we're in Richardson.
Okay. Awesome. Okay. And so now I'm going to move on to what we call registration. So I'm going to say 3 objects, and then I'm going to ask you to say those back to me, okay? So clock, wall, airplane.
Clock, wall, airplane.
Okay. Perfect. All right. And so now the next thing we're going to do is check for some attention and some calculation. So if you could just spell the word world backwards for me.
DRLOW.
Okay. Okay. And so now what were those 3 objects I asked you to remember?
Clock, paint, and ball.
Okay. All right. And now on this table here beside you, what are these 2 objects?
It's a watch and a pencil.
Okay. Which one's the watch?
That one's the watch.
Okay. Perfect. And which one's the pencil?
That one.
Okay. Perfect. All right. And now repeat this sentence after me. No ifs, ands, or buts.
No ifs, buts, or ands.
Okay. And then the next thing I'm going to do is just have you follow this 3-step command for me, okay? So first, take this piece of paper, fold it in half. Okay, and then set it on the floor. Perfect. Okay, and now next we're going to have you read this phrase and follow those instructions. Perfect, okay. And then I'm gonna have you take this paper and right here, just write out a sentence for me.
Okay. Does it matter how long?
3 to 5 words is fine. Okay, perfect. All right, and the last thing I'm going to do for this is I'm going to show you this design, and I want you to just copy it next to it on the paper.
Okay. That right there?
Yes, sir.
Perfect. Will do.
All right, thank you. I'm going to take just a second and tally these up for you.
Perfect.
All right, so today the results of this exam just give us a picture that there might be a little bit of change in your cognitive impairment or your cognitive level, some impairment there. So what that means is just like the reasons you came in, like you're not remembering things all the same, some of the things in your brain maybe not functioning the same as they had been before, which could be leading to some of that confusion, maybe some impairment in memory and ability to follow some kinds of instructions. But don't worry, we can make some changes. We can do some things today that should be able to help manage that for you. Are you currently taking any medications right now?
No.
Okay. And now as we think about plans for helping make some changes, are you open to medications?
I am.
Okay. Perfect. Okay. So before we move on to some of our other things that we can chat about, some of the medications that we're looking at, what they do is some of these chemicals in our brains that are normally balanced to help us with things like memory and understanding and language, sometimes they get to be where they're misfiring a little bit. And so it's not all just like working together exactly like it should. So we can give different medications to try and help manage some of that.
Okay.
The first one we usually start with would be diazepam. It's something that will help with cholinesterase, which is one of those chemicals in your brain. So we can start with that at kind of a low level and monitor for any symptoms. Is that something you'd like to try today?
Sure. If you think it'd be good for me.
Okay, perfect. The next thing that we would want to do is also just go ahead and check some blood work. So another thing that can cause different impairments would be if some of your blood levels are off. Like we can check your thyroid levels, we can check for any vitamin deficiencies, or if something isn't working appropriately, like in your liver or your kidneys, it can cause some changes in impairment as well. Is it okay with you if we draw some blood today?
Yeah.
Okay. All right. And then the last one that you can do is actually just some lifestyle changes. So it's something that you can do. It's something you can get your family and your friends involved with. Do you have family in the area?
I do. My son lives in town.
Okay, perfect. So one of the things that you can do is start being more active and involved in social events. Like if there's a local place that you can go to play games and like get together with other people for social activities,
Like
that's
bingo.
really helpful. Like bingo, yeah.
Sounds good.
So you can do that, especially like meeting new people is helpful. Continue to expand that circle of people you interact with. And then you can also start doing some aerobic activity. So going on walks, playing pickleball, anything like that, like 3 times a week can all help with this, with your brain function as well. All right. Right now, do you feel like you need any assistance at home?
No, I've been managing fine.
Okay, perfect. And are you having any other symptoms other than the memory, like anxiety or hallucinations, depression?
No.
Okay. If any of those start to like pop up, give us a call and we can try a different medication to help manage some of those. But I'll go chat with my attending and we'll start you off with the diazepam just as like a baseline to see where we go with that.
Sounds good.
And then after getting those other labs back, if we need to add anything else, we can do that for sure. Any other concerns or questions you have today?
No.
Okay. And I know you mentioned your son being in town. It looks like we do have his number on file. Is it okay if we talk to him about these things too?
Sure, go for it.
Okay. Thank you so much, Layton. You have a great day, and
You too.
I'll be back with your prescription, okay?
Okay, so now that we are done with our mini mental state exam, just want to follow up with answering some questions about that process and how we will be using it in practice and things we might consider. So first off, how would ethnicity, race, gender identity, and social determinants of health affect our patient and our interpretation of the MMSE? So first off, just want to state too that I saw that a general recommendation is performing this in all adults over 65 when they're admitted to a hospital or when they're changed to different units. But today we had somebody coming in with complaints, so that's why we did that. One of the things that we need to consider is their language. If English is not their native language, or maybe they're not literate in English, like they're not able to read it, then we could see deficits that are not actually related to cognitive changes, but just related to the fact that this isn't their first language. In addition to that, we also need to include just education level in general. So if our patient is unable to read or understand the things that we're talking about, or the language used, then they may receive a lower score as well. So making sure that your patient is able to read and write would be a portion of that as well. Another aspect to consider would be the education level in another regard would be that very highly intelligent, very highly schooled individuals could score higher than anticipated, and in that regard they would be maybe masking some cognitive impairments just because their ability to perform some of those tasks. Also, we have to take into account their job and their environment. So if somebody is working in a job where they may be exposed to heavy metals, then we would want to do a screening for that to see if there's any kind of toxicity that could be leading to the cognitive impairment. So we would need to check for that. And then also with their job, are they the one that's like maybe a single parent providing for the family, working a lot and trying to take care of their whole family and maybe not sleeping well? If they're not sleeping well, then they may not score as well either. Like maybe they worked all night before coming in, they had a night shift, they've got multiple jobs. All those kinds of stressors could definitely play a role as well. Also, depending on where they live. So if they live in an area with like poor ventilation, maybe an old home, maybe they're getting exposed to chemicals or toxins at home, those would be things that we would need to consider as well. You could also think about their activities, like are they outdoor doing things? Maybe they have a tick, they've been out in the outside and they could have Lyme disease. So all of these are things that we need to consider socially. Another would be their nutrition status. So if they're unable to have access to food or adequate resources, then they could have malnutrition, which would also have a negative impact on their cognitive abilities. Also, we could think about age being a difference. If they are quite a bit older than the person doing the screening, do they trust me? Have I earned that respect from them yet? And so they may be a little bit hesitant to answer things. The same can be true with ethnicity as well. So all these are things that we should take into consideration. And with things like language, maybe just make sure that we have an interpreter present so that we can get a good reading on their impairment. Next would be thinking about primary treatment plan. So first thing I'd want to do is assess their medications to check for any polypharmacy, as that can be a major cause of confusion or cognitive disruptment. Are there any medications that they're on that we can either change or decrease, or that may be interacting with each other that are causing some confusion? Or maybe they're on a medication and they're not taking it correctly. I would want to make sure and see if they are on any anticholinergics like diazepam or an NMDA like memantine, or if they're on rivastigmine for Parkinson's, just to see if they've been prescribed those. Are they taking them appropriately? Are they having any difficulties taking them? Do they have any confusion with taking them? And if they are taking them appropriately and they're not working, then we can consider making an adjustment, like changing to a different type of medication, adding on a medication. Maybe if they've been on like the anticholinergic for some mild dementia and things seem to be getting worse, we could try switching them to the memantine to see if we can help with symptom management better. I would also want to obtain labs to check for any thyroid deficiencies, nutritional deficiencies like B12, or any hepatotoxicities or liver toxicities, liver or kidney toxicities, to see if there's any reason that we can explain physiologically in the body why those cognitive impairments might be present as well. Okay. We could also do a CT or MRI if we needed to, if symptoms were severe enough or we had concern for the presence of a lesion or a mass or any type of demyelinating disease, like if they've also started having loss of motor control or vision changes or any problems with balance. It could be something that mood disruption that we may need to see, like, is there something else going on as well that may be a little bit more detrimental. So we'd want to check that as well. Then I'd also recommend some lifestyle modifications, like physical activity, 45 minutes a day with some light aerobic activity, at least 3 to 4 times a week, has shown to help with benefit. And then also cognitive activities like puzzles, Sudoku, crossword, going out and doing those kinds of activities with other people, like getting involved in a group, in a senior center, somewhere where they can be around others, and specifically around others outside of their normal circle, because they're more able to like keep expanding that, the better it is for that cognitive stretching as well. I'd also want to make sure they have all the resources that they need. So if they feel like that they're lacking some resources, I would want to get the social worker involved. And if they feel like they need help with some of these techniques, we could get occupational therapy or speech therapy also on board as consults for them. I'd also want to check their nutrition status, just make sure they have access to food and things that they need at home. And if not, again, that's something that social work would be able to help with. And along with that, I would recommend them having a balanced diet, just eating fruits and vegetables, and also avoiding alcohol. And then with the labs, when we get those back, if they needed to add any kind of vitamin for deficits, we could do that as well. The other thing that we could do is if there's neuropsych related symptoms, we could add on medications for that if they feel like they're severe enough. So like we could do an SSRI for depression, you could do buspirone for anxiety, or if they're having like agitation or psychosis, we could think of adding the quetiapine. Overall, in my assessment of my patient today and my interaction with them, I did feel like I was respectful and empathetic. In my job previously as a dietitian, that's the part I loved the most, was interacting with my patients, and really felt like I was able to gain their trust, and they would share a lot of things with me and be very open just because I related to them well and they knew I cared for them as people. So with my patient today, I feel like I tried to ease the fears that he may have and talk to him about changes that we could make to improve his cognitive function, and let him know that we're here for him no matter what, and to contact us if there's any questions or concerns. So as far as my patient's level of consciousness went, he did have eye-opening and he did respond verbally, and motor responses were appropriate. He was a little confused on some verbal response, so I'd say on like the GCS scale, he'd lose about 1, so not a perfect score, but a little bit of mild impairment there, along with the mild cognitive impairment as well. In the future, a way that I could interact better with a patient is to have them teach back to me the things I taught them, so that I would be able to ensure that they really did understand everything and weren't just agreeing. But overall, I think that the encounter went well. Thank you.